Hello, my name is Dr.R.Krishnanand Pai. I'm a consultant cardiothoracic surgeon at Navaloka Hospital, Colombo, Sri Lanka. The topic of discussion today is a broad look at a coronary artery disease and its management. The word coronary refers in a broad sense to the heart, and arteries that supply the oxygenated blood to the heart is called as the coronary arteries. These coronary arteries supply the blood to the heart during rest as well as exercise. The blood supply to the heart increases exponentially during exercise, and the coronary arteries facilitate to get this blood into the heart muscles so that the heart can pump blood to the rest of the body. Over the years, there is a natural wear and tear which occurs in these arteries, and this is a normal phenomenon seen in most patients, in most people as such. But there is a certain subset of patients in whom these vessels, the blockage or fatty plaques which occur in the arteries rise exponentially with age, and this is something that we call as risk factors. The risk factors for coronary artery disease can be classified as major as well as minor, depending on how frequently they occur in this subset of population. The major risk factors occur in about 75 to 80% of patients, and they include high blood pressure, high blood sugar, high cholesterol, excessive smoking as well as alcohol abuse, as well as obesity and leading a stressful life. Normally, medicines, dietary modification, and lifestyle modification will be able to address these major risk factors to a certain extent. The minor risk factors are: one is a strong family history, as well as certain conditions like thyroid deficiency, which is not seen in most patients and it's seen in a very relatively few number of patients, and therefore it is beyond the purview of this video that we are making today. It is generally believed that most patients do not have symptoms until the coronary arteries shrink in size, or the blocks in the arteries go beyond 50%. The usual symptoms in most patients are chest pain on exertion, which we like to call angina, shortness of breath, very easy fatigability, as well as dizziness on exertion. At this point, it's prudent to mention that in diabetics, about 40% of diabetics, these typical symptoms do not come, and the patient usually presents with atypical symptoms like abdominal pain, gastritis, as well as jaw pain. This is called as atypical angina. They are, however, in spite of all this, they are to be reckoned with, and they should be referred to a cardiac doctor. In some patients, you can have present with sudden onset of severe chest pain, a feeling of doom, sweating, etc., and shortness of breath. This is what we generally call as a heart attack. In cardiology and cardiothoracic terms, it is called as an acute coronary syndrome. When you're experiencing any of these above mentioned symptoms, the prudent way is to progress forward by meeting a cardiologist. A cardiologist will look at you, do a physical examination, and order a series of blood tests as well as an echo and an ECG. This is used to ascertain the risk factors for coronary artery disease, as well as to confirm whether you do have a coronary artery disease which has affected your heart. The most important test for these patients will be a coronary angiogram. A coronary angiogram involves using a dye which is injected into the patient's coronary arteries, and images are taken at different positions around the heart. This coronary angiogram will help us decide once and for all whether you have a coronary artery disease. If so, how many stenosis are present and what is the degree of stenosis. This will help in managing the patients forward and referring the patients accordingly for further treatment. About 50 to 60% of patients have about 50 to 70% stenosis in one or two arteries. These patients are usually managed medically with medicines, dietary modifications including low salt diet, as well as a diet which has no decreased processed foods, as well as lifestyle modifications including regular exercise as well as cessation of smoking and alcohol abuse. In patients who have more than 75% lesions in one or two coronary arteries, they are usually referred for stenting. The cardiologist will put a stent in these coronary arteries. They will open up the stenosis and put a stent, and this stent will last you for at least 3 to 5 years minimum, so long as your dietary and lifestyle modifications are true and permanent. In patients who have got the stenosis in all three arteries, as well as in patients in whom the cardiologists feel a stenting is not possible, these patients are referred for coronary artery bypass grafting. So, what is coronary artery bypass grafting? Coronary artery bypass grafting is a surgical procedure which is performed where the blocks in the heart are bypassed with conduits taken from the patient. They can be taken from the leg, which is the saphenous vein. They can be taken from the non-dominant hand, which is the radial artery, or they can be taken from behind the breastbone, which is this, and that is the left internal mammary artery. These conduits are used to bypass the blocks and increase the blood supply to the heart, so the patient remains asymptomatic. The procedure takes about 3 to 4 hours, and after the procedure, the recovery period is 5 to 6 days. At the time of recovery, the patient is fully mobile and able to climb stairs. The general recovery continues in the postoperative period at home, and by 5 to 6 weeks, the patient is usually fully recovered to start his activities, to start normal working lifestyle, and the results of the procedure will last about 15 to 18 years, and this will give a patient a symptom-free lifestyle for a minimum of 15 to 18 years. A more important fact is that once the procedure is done, it decreases the risk of a future heart attack as such, and therefore improves the survival of the patient. So, the benefits of coronary artery bypass grafting, in short, is a symptomatic improvement as well as a survival benefit. So, this is the salient features of a rough guide to management of coronary artery disease. If you do have any further questions, you can please address it to my WhatsApp or to my email, and I will be more than happy to answer these questions for you. These are provided in the slide behind, and thank you for your patient listening. Thank you.